Hello, my name is Dr. David Maahs. I'm a pediatric endocrinologist at the Barbara Davis Center for Childhood Diabetes at the University of Colorado, Denver, and the Children's Hospital, Colorado. And I'm speaking to you today about a recent scientific statement from the American Heart Association on cardiovascular disease risk factors in youth with diabetes. And I'm speaking as the co-chair for this writing group. There are many important reasons for this statement. Both type 1 and type 2 diabetes are increasing in youth. We know that cardiovascular disease is one of the leading causes of morbidity and mortality in people with diabetes. And in the past decade, there have been several published guidelines on cardiovascular disease risk factors, their identification and treatment in youth with diabetes. And so in this scientific summary, these guidelines are reviewed, new developments in the field are summarized, including a lot of the key research that's been done in the last decade. We also outline future research and clinical needs to improve cardiovascular health and risk factor management in youth with diabetes. The goals of this statement include to increase the awareness of cardiovascular disease risk factors and their identification, as well as their prevention, as well as the treatment of these risk factors to improve cardiovascular health in youth with diabetes by encouraging advancement in research and clinical care. So this scientific statement complements a recent American Heart Association statement on type 1 diabetes and cardiovascular disease by now focusing on youth with diabetes. And in youth with diabetes, type 1 diabetes accounts for 80 to 90% of diabetes, but our statement also includes then details on type 2 diabetes in youth and cardiovascular disease risk factors. And as we know, type 2 diabetes is an emerging concern in pediatric medicine. So our writing group includes a broad range of expertise, including pediatric cardiologists, endocrinologists, nephrologists, behavioral scientists, and pediatric nursing representation as well. Some of the key messages for clinicians and patients are that, one, elevated cardiovascular disease risk factors do exist in youth with diabetes. Second, that current guidelines should be followed for screening, as well as appropriate then therapy for abnormalities, which includes lifestyle change and in select cases, pharmacologic treatment. In summary, we believe that this new scientific statement provides state-of-the-art review of cardiovascular disease risk in youth with diabetes and can set the stage to improve care, improve research, and improve outcomes for these children with diabetes. Thank you.